I mean, one of the other things that Stephen Duckett, did mention when he was on the last webinar was that he felt that it was important to have, or at least advocate for a universal dental program. We know that in this survey, we actually asked people if they'd actually be willing to pay a higher Medicare levy to have dental cover, dental care covered by Medicare, and more than half actually said yes. So there's certainly an interest that maybe the private health insurance sector, who obviously historically the people who've covered dental care, may not be covering enough, or doesn't provide the sufficient coverage in order to provide access. What are our views about dentists and having a regular dentist, and cost concerns around minimising people not accessing dental care?
Well, Marcus, dental concerns have been a key issue of the survey for some time. We know that less than 50% of those respondents have a regular dentist. They don't like the experience and they don't like the cost, and it's very expensive going to a dentist. But poor oral care leads to poor health. We've got to do something about it. We know that when Medicare was originally set up 50 years ago, the government couldn't get the support of the dentist to be part of Medibank, as it was then called. So we've recently made a submission on dental care, and in our strengthening Medicare submissions, we say that dental care should be included. But we know it'll take time, and as Stephen Duckett has pointed out, it's going to cost a fortune. It is pleasing to see that most of the respondents would accept the increase in the Medicare levy to cover that, but would only partly cover the costs. But we do need something to do. We do need to address this. It's going to be a long-term issue, but really, at first, we need to look after the needy, those on low incomes. I think it's a bit like having a GP's appointment. We can't afford to give free care for everyone. It really just needs to be directed to those in most need. The rest have to pay for their own dental treatment.
I mean, Stephen raises some interesting points there, and one of them is that dental care is almost the inverse of medical care in terms of when you want it and need it in your life. You want your dental care to be formed as a habit as a child and an adolescent, and nearly all of the consequences of poor dentition occur to you in adulthood and then later in life. As an infectious disease physician, I see people with infections on their heart valve, endocarditis, because they've got poor dentition. So two things about dental care. I think if it's going to be free, you could seriously argue, and I think we did, Stephen, in our submission, that it only be free for up until you finish adolescence when you're 18, or maybe you want to peg the number at 25 or wherever, because it may not be affordable to give. And the second thing is, don't make the same mistake, or I won't say mistakes. It's not a mistake. It's been a great policy for Australia, but learn from the current challenges of Medicare, and don't form a Denticare that mirrors what Medicare looks like now.
Nick, that's true. It's just for younger people. When you're going to school, you need to get into the habit of regularly visiting a dentist, checking on the health of your teeth, and hopefully that develops good habits to continue later on in life. So once you start earning the income, you can afford to see a dentist.